Hi friends, let me get you to the core of arthroplasty. I have myself experienced this area. I have seen how they work there, and I see the man who heads the team right in Germany at Escalpios, the director, Professor Heiko Graichen. Welcome to Conceptual Orthopedics, sir. My first question to you, if I have to choose arthroplasty as a branch, and I am during my residency of orthopedics, but I am thrilled by being a joint replacement surgeon. How do I shape my career, or how do I plan to go about it, sir?
I think you should have an interest combining theory and practical skills. So as I try to teach my residents, although you're an arthroplasty or want to become an arthroplasty surgeon, you still have to read a lot of books. You have to understand the procedure before you start doing the first one. So there is a lot of learning before you can start your career. This is comparable to all the other fields, so it is nothing different. But some of the arthroplasty surgeons, they are so much focused on the procedure, and they will not get very good results. So be patient, try to learn as hard as you can, and I always recommend to see different places. So if that is possible in your career, try to use that option, because you always can pick some highlights from every surgeon, and also some maybe not perfect things can be helpful for you in your later career.
Thank you, sir. That comes to my second question. You've been a navigation replacement surgeon. And if I want to be a navigation replacement surgeon, do I go to a center which works on navigation, or do I go to the first center I get an opportunity on? So should I start my training right from the place where navigation is the primary thing, or any high volume arthroplasty center should be the point of focus? How do I choose if I get a fellowship in India or abroad?
So I think first of all, you should understand the principles of the surgery, and this is independent whether you're a conventional surgeon or a navigated surgeon or a robotic surgeon. So start your career in a high volume center where you see as much conventional surgery as you can. You have to understand that the different workflows, the different philosophies. And if you have collected them in your head and cleared them, then it's a good time point, if you're interested in digital technology, to go to a specialized center where they do that 100%. I think it's a yes or no decision. If you're convinced on digital technology, then you will never jump back. So this is, and then you learn it from the experts again.
Right, sir. And the third point, an arthroplasty career throughout the world is somehow reaching a threshold. There's a lot of competition because this is the number one done procedure in the world in orthopedics, if you take a knee being the most commonly replaced joint, if you take into account. Do you think as a young surgeon, I will have a scope? I have all the doubts. I get this mail number one. Is it saturated or still there's a scope?
I think there are different structures in orthopedic centers. What we now have changed, we built teams on joints. So that means that one team is treating everything in the knee, from the smallest arthroscopy to the largest knee revision. The same for the shoulder, the same for the hip, the same for foot and ankle or the hand surgery. So that means they are expert in one joint. and of course in their career before they're really the expert, they see the different joint centers in my hospital. So this is how we want to overcome that problem that no one wants to scope. You're right. So that is that can be a problem. But to be honest, I think good arthroscopy plays a big role in treating knees, and only a few knees finally will be treated by a total or partial knee arthroplasty. So it's a long way. And you as a doctor, you should be a knee specialist. So like the internal medicine has a heart specialist or a liver specialist, you're the knee specialist, and you can help the patient from conservative treatment up to the latest revision. Everything you're the expert on. I think that's the answer for that.
Right. And the last question, sir.
Yep.
Orthopedics as a branch for females.
I definitely see there is a change. So when I look back at my department 10 years back, there was no female. Nowadays, we have almost 30% of our doctors are female. So there is a tendency. But you are right. There are fields in orthopedics that are maybe more female than others. I think a hip surgeon, he has to do a lot of hard work, especially in obese patients and hammering and all that. So maybe that's not the best field for a female. But if you look at shoulder, elbow, hand, foot and ankle, and even the knee, they can be experts in that. They have to be interested in joints and in ligaments and reconstruction and all that. So if they love that, they're a perfect candidate. Then there's not a big difference between a man and a woman.
Right. So it's an art, basically. It's just not the manual work.
This is what I always try to tell my youngsters. It's a bit of an art, and you have to be passionate about that.
Right. So passion is the word that drives everything in the world. So.
Yes.
And thank you for this small talk, and thank you for the wonderful talk, sir. Thank you very much.
Thank you very much. It was a pleasure.
Yes.
As
what